Good afternoon to those of you in the eastern portion of the U.S. and good morning to those of you in western time zones. Welcome to the first of two very interesting and timely webinars on the topic of telebehavioral health. These webinars are brought to you by the SAMHSA Behavioral Health Information Technology and Standards Initiative. My name is Alan Mogul, an associate scientist with Abt Associates, part of the BHITS team. As we now move to our customary housekeeping rules, a reminder that a PDF version of this PowerPoint presentation will be emailed to all registered participants for this webinar. Please note that the webinar is being recorded and will be posted to SAMHSA's YouTube page, located at www.samhsa.gov. Please note that all lines are muted. You may submit your comments or questions via the chat box feature, typically found in the lower right portion of your screen. We'll save all questions for the final 15 minutes of our hour together. This is the first of a two-part series of webinars to be held this month. The next webinar in this short series will occur at the beginning of next week, Telebehavioral Health, what every provider needs to know. Registration link has been sent out. If you would like to be included on the listserv, you may send an email to healthitwebinars@aptassoc.com. With that, I'd like to now introduce today's featured speaker. Dr. Marlene Mayhew serves as the Executive Director of the Telebehavioral Health Institute, found online at www.telehealth.org. where she oversees the development and delivery of professional training in behavioral health via an e-learning platform that has served consumers and clinicians from over 70 countries. The focus for Dr. Mayhew has been legal and ethical risk management related to the use of technologies to better serve behavioral health patients. She has served as a consultant, researcher, author, trainer, and keynoter. And with that, Marlene, the floor is yours.
Thank you very much, Alan. I appreciate your including me in your series. First question that typically comes up is whether there's enough research in the evidence base to support the use of telebehavioral health. And the truth is that, yes, indeed, there is a lot of research. Actually, this has been going on since the 1950s in the United States and worldwide as well. So at this point, we have about 4,200 articles that we've databased at our institute alone talking about the effectiveness of telebehavioral health. The reason for this big focus on research is that behavioral health in general is the largest unmet healthcare need in the United States. So the next question that we often get is, why aren't more behavioral professionals available online? And the best answer I can give is that indeed the behavioral world has been one of the last ones to come online in all of healthcare in terms of the general practitioner base understanding what the rules and the regs are. And part of that is because it's been a very conservative world. We have to be conservative because a lot of the people that we deal with, certainly not all the people, but a lot of the people can be struggling with issues like suicide or homicide or abuse. And so we have to proceed very carefully, and that's the licensing board itself, as well as the professional association. So as a result of that, most behavioral clinicians have not been trained, and the graduate schools haven't gotten to training either. As a matter of fact, we're writing another book specifically for graduate schools right now, but I believe it'll be the first book that is targeted just for graduate schools and that level of training. So if you want to ask, well, what can you do as a consumer to help make telebehavioral health more available if you really are interested? Well, you can do things like contact SAMHSA, which is a federal government arm that oversees substance use and mental health services, which are now being called telebehavioral health. You can thank them for this educational program and ask for more services too. You can also contact your state professional associations and talk about the disciplines involved and say, okay, I've been interested in social work, then there's a social work association at the federal level or the national level, which is the National Association of Social Work, or there may be one for your state, so Ohio Social Work Association, Florida Social Work Association. So states have professional associations, and you can tell tell them, hey, I'm interested in this. So if you work with the channels that already exist, your voice will be heard a lot more strongly than if you just go on the internet and try to find people out there. You can also contact your state licensing board for those disciplines involved. Once again, if you're interested in finding a social worker or a psychologist or a psychiatrist, depending on what your needs are, then you can do that. The other thing to keep in mind is that there are 9 behavioral professions in our entire behavioral world. That's a lot of different groups to keep track of. So those professional associations include the addiction specialists, behavior analysts, behavioral nurse practitioners, counselors, marriage and family therapists, psychologists, psychiatric nurses, psychiatrists, and social workers. So I'm giving you these names. Now, if you're interested in this, I want to encourage you to go take a look at what these disciplines are and who might best serve your needs, because you may not know the difference between, say, psychiatrist or psychologist, or social worker and counselor, psychologist. So every group has its own specialty, although there's a lot of overlap. So if you're going to look for a professional, what should you seek in a professional? First off, look for someone that has expertise in whatever you're struggling with. So let's say it's raising a family, or if you're having marital difficulties. Well, you want a family specialist or a marital specialist, number one, because if they're not trained in the basic thing you need, then no matter what they do, it's not going to hit the mark, right? And then you may want someone that has training in telebehavioral health, which is delivering services across distance through a camera or on some other type of technology. And those really are 2 separate types of training. Many people believe, including, this is rather disconcerting, but a number of professionals believe that it's all the same. The truth is that everything that you do as a client or a consumer or a patient gets mediated by a camera when you're doing video conferencing. And there are a lot of things to be aware of and to protect yourself when you're doing it as well. And the clinician needs to be not only aware of your needs, but their needs, their legal obligations, and other obligations. So there's a fair amount of training involved. And the best way to make sure that you're getting what you really want is to go with someone who's licensed. So someone's license has legal responsibilities to you and to the state that they're licensed in. So I'm going to go through some of the ways that you can be sure that your clinician will protect your private information attending to your specific needs. One is to recognize that licensed professionals are required by law to protect your information, and that there are federal laws that impose pretty severe penalties for violating your privacy. Some of the examples of those laws include HIPAA. You might have heard of HIPAA, so that whatever technology you use has to meet standards that are set by the federal government. The HITECH Act also imposes certain penalties for not paying attention to the HIPAA laws. And as we go down into the states, there are state privacy and security laws. So some states have even more privacy and security requirements than the federal government. Texas, California. There are a number of states that have additional privacy laws, and these are generally the states that are known as consumer protection states, where they go above and beyond what the federal government says and requires clinicians to do extra things. So there are certain things in place that you can count on when you're working with a licensed professional. Professionals also are required by an ethics code. They may not belong to the professional association, but whether or not they belong to the professional association, they are held to standards of an ethical code. And so you can look, once again, social work, behavior analyst, or nurse, therapist, whatever discipline you choose out of the 9, just know that there are professional groups that do set standards. And then, of course, the licensing law not only protects your privacy, but does that in a number of ways. And we'll get into some more. But what I'm trying to let you know, the entire professional practice, telehealth and telebehavioral health in the United States is also defined by state laws rather than federal laws. So if you want the final word on what a practitioner in your state is supposed to do, it's to be found at the state level, at the licensing board, where they're registered as a licensee. Okay. Now the thing to know is that states can be different. And this is why we don't have laws yet where professionals can practice over state lines, because the different states haven't all come to an agreement about what's okay for their licensing group. So we've got a fair amount of discord between the states professional legal. And my advice to you is to make sure that you're following this carefully when you're working online, because there are many ways that this is getting compromised, and that means that your own safety and protections are getting compromised. The thing is that state laws are in place to protect you. If you choose to work with a professional who's unlicensed, what you're doing there is choosing to work with someone who could not even demonstrate a level of minimal competency to meet one state standard. It may not be someone that you want to trust with your emotional health or that of your spouse or your children or your family members. The licensure helps differentiate that, just like a driver's license helps distinguish who's at one point in time passing minimal competency exam. Can you back up safely? Can you parallel park safely? If you can't do that even at one point in your life, then you shouldn't be driving, is the point of view from the Department of Motor Vehicles. Well, that's the same with licensing. You want to be able to count on somebody having demonstrated with an exam that they do know what the rules are. So if you choose to work with an unlicensed professional, the law can't protect you. So if something goes wrong, and things can go wrong, so then you really have no recourse. Now, where do you try to find licensed people that are appropriate to work with you? So you can go to the state licensing board and look up who are their licensees, who might be licensed in your area, or if you can get a license number from a professional, because all of us that are licensed are mandated to make that public, make that licensing number public. Then you can go look them up at the board that they claim to be licensed, and if they're not there, then they're lying to you. So be careful about that. Now, the job of the licensing board is to keep out the bad apples, right? So they will only publish the license numbers and names and addresses of the people that are licensed. Just like a contractor with a state with the contracting board, you can go look up their license, and you can do that. The real point here is that behavioral issues can create serious vulnerabilities, and you may not even be aware of them. And that could be part of your vulnerabilities. You don't know you're vulnerable. So our job is to know your vulnerabilities and help you identify them and deal with them. So another part of our job is to make sure that we don't use those against you, that we don't take advantage of what you don't understand, rather we try to help you understand it. And so when you're working for an unlicensed professional, they're not held to that standard because there is no standard that they're being measured up against. So my caution to you is be careful you're working with licensed people. Hopefully you got that one, because I kind of get that one hard. Now, what about your safety online? That's a whole other thing. Licensure in general, and then what about online? One of the most important things to think about is that your setting is one of the most crucial things to consider. And once again, telebehavioral health has been documented for the last 60 years. Safe and effective protocols have been identified for decades, but the factor is where you are. If you're in a professional setting, let's say a physician's office or a psychologist's office, those are recognized by Medicare, for example, then you walk in there with a certain level of expectation, and the professionals are expected to treat you in a certain way too. There again, if you're on a locked ward in a hospital, then you can be worked with there because there's a lot of safety, a lot of people around, the environment is controlled, you're safe. So any type of diagnosis that you could possibly imagine has been treated with telebehavioral health. But the setting is what differs, and the levels of control that are there to protect you are different. Now, when you start moving to getting services in your home rather than the professional office, there are more variables that can come into play. Your connection could be spottier. There are people that could come in and out of your session. Your neighbors might be overhearing you. So a lot of fewer things are controlled. So generally, it's not a good idea if you are psychotic to be working from your home, because there's typically not anybody there to help you out, help a clinician out. So less severe diagnoses are addressed in home settings. Now, there are public settings that can be dealt with as well, such as somebody trying to deal with social phobia or the fear of going and speaking, and we have to actually speak in front. So there are certain types of disorders that can be treated publicly, but there again, the therapist involved with that has to have a lot of special training to make sure that they can control what needs to be controlled in the environment. So I'm trying to drill down here to help you find a more qualified telebehavioral professional. So first off, start with your prior therapist. That if you've gotten along well with a therapist, that's the first place to go look. Contact that person. If you have insurance, ask them who they may have approved already to work with you. If it's not your prior therapist, and ask if your prior therapist was willing to get trained if they have never done this before, because most professionals have not done telebehavioral health. So there are a number of places that professionals can be trained, in addition to the types of training available through this medium here, through SAMHSA. There are private institutes such as the one that we run at telehealth.org, called the Telebehavioral Health Institute. There are also a national professional conference. I, for one, give daily workshops, 2-day workshops around the country, and a lot of them are the National Professional Associations. There are many other people doing that now. And you can also look through your state associations, which I mentioned earlier. They may have a workshop or a credentialing experience that professionals can engage in. So again, go back to your government entities, go back to your state associations, your national associations, and ask them. And SAMHSA, I actually gave you the URL here, where there are some up-and-coming trainings for telebehavioral health professionals. Now, ask me, well, how else can I find somebody online? Now, you may find companies online that sort of have directories up of professionals. And what you want to ask them to do, because what you want to do when you evaluate them, is to see if they ask you to identify your state of location at the time of contact. They don't ask you to say you're from Oklahoma or you're from Florida, then they're pulling you into a panel of practitioners who probably not licensed appropriately, in which case you have no recourse if something goes wrong. And they're asking those clinicians to practice legally, which is not a good thing at all. So you just want to make sure that when you go into a system, that they're asking you to identify your state, where not only you live, not where you reside, but where you are physically at the time of contact. They also engage in a form of informed consent process. And we'll get into some of the details of that, but there's a thing called informed consent process that is key to protecting you. That is the one thing that you need to be most focused on, is did you get full informed consent? Did you agree to all the stuff that's down? Okay? And as part of that, especially for telebehavioral health, the safety plan has to be identified. As who else can be contacted if it's an emergency? Because when you start working in mental health, behavioral health, substance use, things can come up that you don't anticipate. So a good clinician, a licensed clinician, is legally responsible to have backup plans and not just be winging it, and have continuity of care that is available to you all the time. In many states, that's required actually. So you want to make sure that that's all part of this informed consent, and to have detailed discussions about what happens if something breaks down. So let's say we were right now working in telebehavioral health video, and the connection just stops. What are you supposed to do? You should have sort of a to-do list that you can follow there, and that your professional has worked out with you. So of course, what else can you do to find the right type of practitioner for yourself? Check their professional license at their board level, and then contact the state and national associations for the type of professional you might need, and ask them if they have qualified professionals on there. But what about some of these companies? Let's go back to this topic of some of these companies. There are many that have started, and I see about one a week come up. Some of them are good and some are not. I'm going to try to help you distinguish between the not so good ones and the good ones, okay? So that you can be sure that what you're doing meets your needs. First, look at the terms and conditions file at their website. Who do they make responsible for complaints or something goes wrong? Do they have tech support? Are they trying to pin all the responsibility on the practitioner, and they are just going to act like a phone company? So look out for that, because it would be in your best interest to have opt into a system where you know exactly where the lines of responsibility lie, especially when you're going for some type of behavioral support. Don't want to get caught in between some of the legalese and the documents that might just basically let everybody off the hook, and you're you're pulling back. So definitely want to opt into a system that is very clear about who's responsible for what. And is there a phone number that you were supposed to dial if something goes wrong technically? Call it. Call the number, see what happens. Do you get sent to a voicemail message? Do you have a live person answering you? If you have to send an email, and how long does it take? Well, I know this takes some upfront investigation, and some people just don't want to bother with it. They just want to go online, and that is your choice. But as a professional who's been in this field for a long time, I want to encourage you to take a few extra steps, because even if you want to see somebody in your community, we did an in-person type arrangement with somebody, you would have to get referrals. You would have to get dressed, drive over there. You would have to sit in their waiting room. You would spend at least an hour or two before you were seated in front of them. Spend that amount of time doing some investigation up front before you pick somebody online, and I think it would do you very well. Also, you want to be very clear about who pays for the service and how is that money processed. Is that going to show up on your credit card bill? And if so, what is it going to be called in your credit card statement that you may leave laying around your house and somebody else picks up and says, hey, I didn't know you were getting anger management services from this company. What's going on? So just companies should not be naming your psychological, psychiatric, or mental health services in your credit card statement. So you should be much more discreet and protect your privacy when you're doing that. How else do you look for a qualified practitioner? You can look at some of the online directories of the startup services, and then see if they will let you talk to the professional ahead of time so you can ask a bunch of questions I'm just about to give you. And that's the one thing. Second thing is download a copy of their informed consent document so you can read all of this and see if this makes sense to you, or if you have questions about it that you then want to talk to their professional about. I want to caution you about being leery of some of these online companies and some of the clinicians you'll see online, because many clinicians that started out 10, 20 years ago thought this was the Wild West, and they could do anything they please. So even though they were licensed, they have the misconception that they didn't have to follow any of the rules of licensure online. Actually, we just published a study. My research team and I published a study 2 months ago that showed that this is still a very, very common belief, misconception that they don't have to do anything related to their licensure if they work online. The internet is not the Wild West. The internet is controlled the same exact way as an in-person practice is. All the things we have to do as professionals in person, we have to do online. Many of the companies that have started up don't require it, and they lead to your believing that it's not required, just by the way they're set up. So first off, you have to know that there are no external authorities that police claims on company directories, professional directories, or private websites. Now, you have groups like the Trade Commission that says you can't be fraudulent in your claims, but they don't actually go out and regularly police these sites. So a lot of them are slipping through the cracks. The same thing is true of licensing boards. They do set standards for clinicians, but they don't have an investigative team that goes out and looks up what clinician A or B or C will be writing about what their expertise is. And a lot of the clinicians that have gotten online go ahead and list a wide list of specialty areas they've worked in. They might have had 2 months of working with somebody in the prison system, but now all of a sudden they are specialists in criminology. Not necessarily true. So they're a little looser than we'd like to see in their descriptive profile descriptions about their expertise. So you can ask questions about that. Definitely want to look for a specialist in the issue that you think you're dealing with, thing you need addressed. And then, of course, I'm going to keep saying this over and over again, check the clinician's licensure. Also, if you're leery of the licensed clinician, let me say that again. Even be leery of the licensed clinician who offers services through platforms that minimize how much information they can collect from you. Now, no matter how well trained or how good a clinician is, they're not mind readers. And if a platform only allows them to get a minimal amount of information from you, they're not going to know how to work with you. I don't care if they're geniuses or not. It's physically impossible to know exactly where you come from, because if you think about the internet, people from all around the world in hundreds of languages with thousands of cultural groups and different types of backgrounds can be typing the same thing into an interface. How's that clinician going to know what your context is? It's impossible. So think about how we're trained as clinicians. We're trained in person to start with, and we are trained with somebody watching us, and we know the context, full context. We actually sit with you, we can smell you, we can look all at all of your body, listen to your voice tone. All these keys are very important for us in how we guide somebody. If you strip all that away from a clinician, how can they possibly do well? The only way they can do even close to well is if they get some training and how to adjust for that, how to make that difference between in-person and online so small that it's really not going to interfere. But even if you get the number of hours that we offer at our institute, which is 15 to 40, none of that is in mind reading. So you've got to be realistic about the amount of information that you are giving somebody. While it may be convenient to not show up on video and only do contact and email or text messaging or even telephone, you're not giving a clinician a whole lot to work with, and they cannot work with what you don't give them. So I think the best analogy I can come up with on this is if you go apply for a rent or you go get a mortgage for a home, if you start looking at homes, try to find a new place to live, you'll be getting and giving all this information. And if you aren't willing to give that same amount of information, not type of amount of information, then you could be at a disadvantage when you're trying to work with a clinician who says, yes, they can work with you. Really, they're not equipped to do so. Now, what about all of the promises that you'll find some of these online companies making? First off, pay attention to whether they take responsibility for such a market, or they're just plugging you in through to clinicians. If they're only a phone company and they're plugging you through, then they may very well have gotten a $4 million or $6 million or $10 million marketing budget, and they can promise all kinds of things, but that clinician is really divorced from those promises. They're just signed up to do licensed work, and they may not be cognizant of all those promises. So where's that responsibility lie? And does that company that you're plugging into ask you to provide emergency information? Does it ask you to sign an informed consent document, which is required by state law for all licensed professionals to identify where you are? If not, you can just jump on there willy-nilly and think about that. How can somebody possibly do their job if they're licensed and they're supposed to be adhering to certain regulations? And look at the company disclaimer, because the disclaimer may give you a clue as to what they're accepting responsibility for or not accepting responsibility for. So what not to consider when responding to some of these things are millions of dollars in funding that come from investors. And sometimes the investors don't really understand the industry that they're investing in. I hate to say that, but it's really true. And the company may use big names, they may use movie stars, there may be Olympic athletes, there may be people that get paid a fair amount of money to endorse them. But what does that mean in terms of you and the care you're going to get? Probably not a whole lot. They may also throw flash numbers around if they serve 1 million people here or 6 million people there. So what does that have to do with you? Well, the devil's in the details here. So look at what some of the motivations might be. There's a lot of talk about disrupting and disruptive innovations, disrupting practices. And to be honest, I've been working in telehealth now, telebehavioral health for 24 years. I'm the biggest supporter for innovation and disruption, as long as you give all the rules. But if you're going to throw the rules out along with the in-person care, then you're not doing, in my opinion, you're not doing the consumer a whole lot. So be careful about things that groups that just get big money and they flash big numbers and they have wonderful campaigns and they fill your inbox or web pages with ads that follow you around the internet. Be careful about that. Better stick with people that are licensed, that have demonstrated they know what to do, and that do follow the things that I've been telling you on informed consent, by you knowing exactly in terms of conditions, file what's going on, and you won't find very seasoned clinicians working with some of these very, very big outfits on a regular basis. So be cautious about it. And also look at the safeguards that they put in place. So what's the intake like? Do they ask you about your history? Do they ask you about medications you're taking? And medications really impact your mood. It can make you impulsive, it can make you more sluggish, it can make you thick-headed. Do they ask you about that, or are they just going to give you an answer to some question you ask? Do you have a prior diagnosis? Have you gotten prior treatment? What's worked, what's not worked? These are very important things for a clinician to deal with when they're starting to work with you. If there is no informed consent, what exactly are you being told about the information that you're giving people? Where's it going? So there's a lot of things that you may want to know about. Now, look at the numbers of people that have been used. Are the numbers real? When they flash numbers, when some of these companies flash big numbers, is there some group that checks on that? Actually, no. There's no official group that will go out to check on it. Most government groups rely on complaints. Once a complaint is filed, then they go investigate. So not what a lot of us would like to have happen, but it's true. So now I'm going to shift over to helping you understand informed consent. Some of the things that you need to be made aware of, and these are general rules that are set not only by licensing boards, but by professional associations. You get to choose the technology you prefer. You don't have to work in video or on telephone or apps, and you don't have to do any of this if you don't want to. And whatever you do choose to use, you should be given an explanation of the risks and benefits are. This may not occur to you. You also should be pretty well skilled in how to do it, and if you're not familiar with how to use the technology, training should be made available to you so that you are skilled. Definitely don't want to use some technology if you don't know how to use it. You also need to know the clinician's availability. Is this a one-time thing where you're going to talk to them with one question, or do you get to see them another time, or 3-4 times, and when? When is that? Will it be once a week, once a month? You have to wait 2 months to see this person again, and then meanwhile you're supposed to be seeing other people. So get all this information up front. All of this is part of the informed consent. If you choose to opt out of the technology, what are the repercussions? Are there any? You should be told that there are no repercussions. You should have the freedom to come and go as you please. You're the consumer. What about payment arrangements? Will you be billed automatically? Will you not? What's going on with your credit card or whatever your payment system is? When will this clinician violate your privacy? Because there are certain conditions in a professional practice where if you tell somebody you are abusing elderly people or children, or if they have a reasonable suspicion to believe that, then they will need to report you, because clinicians, all clinicians in healthcare, including teachers and the police, everybody's a mandated reporter to help protect society. So there is no total privacy anywhere, even in a private practice. Telling somebody that you're going to be abusing somebody, then there are repercussions for that. Or if you're suicidal, homicidal. So there are repercussions for uttering those words, and you need to be told that up front. That's only fair to you to be told that. What about ways you protect your own privacy? Maybe securing a babysitter for your children, or how do you repair your computer? You take it down to the local shop, leave it there overnight. All these things should be dealt with. What about intrusions or interruptions, people walking into your session? How can you handle that? Can you tell code words? It's a very common practice. Telebehavioral health, develop a word, a phrase that lets the clinician know that somebody just walked in there in your room, and you don't want to necessarily say that, but you want to transmit a message that would be great if they shut down the session and then you were not exposed to any more questions about whatever you're talking about. So there's things like that, agreements that a clinician should be making with you so that you know it's okay. If someone walks in or something unexpected happens on you. And then there should be an emergency plan, including emergency contact names and numbers for the clinician to call or something like that. So now I'm going to give you a list of questions to consider that you can ask your clinician when you get started. Okay? Number 1, are they licensed in their state? Because if you're in California like I am, and you want to work with me, then I'm a clinician and I may be available to you, but then if you go out of state, I can't work with you there because I'm not licensed in that state. So you definitely want the license numbers of everybody you work with and what state you're licensed in. And then ask them how much experience they have in the in-person practice. Let's say I'm going for family therapy. on having difficulty managing a 15-year-old. Okay, then how much experience does the clinician have in dealing with that issue? How many people have they treated? It's always a good question. Oh, you treated 12 people. Very different than you treated 150 families, all right? So where are they in their line? How many years of practice have they had? Do that kind of thing. Now you switch to the online world. How many people do you treat online? Okay, because some people may have very well practiced 30 years, but they've only had one client online, or 2 or 10. They're still learning, okay? Do you really want to be in that mix? You may, but you deserve to know the information, and then you make a decision. Well, how many people then have you treated with my issue online? You see, I'm just drilling down to what's the best clinician here for the kind of issue that you want to come in with. Now, more questions. How many hours of formal training have you had working in telebehavioral health? Oh, well, I heard this thing on the radio with NPR, I love NPR, but that's not formal training in telebehavioral health, okay? Someone is trained in telebehavioral health when they get a course completion certificate. If any course that offers a continuing education hour in our country is documented by a student, how many certificates did they get? How many hours of training did they get? Is it 3? Well, that's a whole lot different than working, right? So be an informed consumer here. Do they use HIPAA-compliant technology? Are they going to be HIPAA-compliant technology, by the way, is a federal standard that sets privacy and security and any transmission of your information. They're not using HIPAA-compliant technology, and they don't know what it's doing. That's to use it or discontinue treatment from them, okay? Ask them if they're recording you, okay? Ask them what's going, where's that recording going, okay? Who's going to have access to any recordings or notes or other records in the system? Is the supervisor going to be looking at this? Is there a case manager looking at this? You have the right to know who's going to be seeing your personal information. How will you know if anybody else is in their room? Will they scan the room with a camera? Will they verbally tell you nobody else is in the room? How often will they do that? Will it be every session? Will it be every 10th session? Just how can you manage that? Is it okay for you to record the meetings? Most clinicians will say no, because some of that can be taken out of context. But what should you do if someone walks in? Can you give them a high sign? Is someone going to pick that up? Just how is this going to happen? What if someone walks into their room and you see it, but they don't? How can you talk about that, deal with that? Can you bring somebody else into the session? Should you tell them ahead of time? Should you not? Should you pop in? So most clinicians will have requirements of you about that to let them know what's going on. Who should call who if you get disconnected? Or what's the next step going to be? You just let that go and not come back for the next session. There's all kinds of things you may just want to think about. And then how can you be sure that they're following all the rules? See what they say to that, right? Because if they don't follow the rules, then how do you even know that, right? They can assure you that they're licensed, for example. Do they recommend any particular apps for you? And if they are they validated? Where do they get these apps? Are they just someone that they heard what was good, or how do they vet their app? Can you text them? If you do text each other, which technology? Because if you use technology on a cell phone, a traditional cell phone, that is not secure. And those messages can stay in your SIM card on your phone, as well as the hard search tree on the phone. So do they know about that? Do they know about protecting your privacy there? Should you be sending them email that includes diaries, long explanations of what's going on with you? And then can you get your insurance to cover if you do have insurance? What can you expect to pay for telebehavioral health? It really depends on the service you're purchasing. Some companies will sell you the ability to text message somebody as a one-time thing. There again, I want to encourage you to think about all the requirements, even think about informed consent. How do you do informed consent with somebody? Which, by the way, is a meeting of the mind for you and the clinician. Have come to an agreement about what's going to happen with you, and the clinician is reasonably assured that you understand that agreement. Okay, well, how do you do that text message? You don't really get to talk to somebody. You don't get to hear their voice tone, hesitancy. You get a little text. Yes, I agree. So think about that. So is it a one-time service? with no continuity of care? Does your state require continuity of care for clinicians? Because most states do. Most states say that if you start a relationship with a consumer, if the licensed clinician starts a relationship with a consumer, you have to be available for ongoing services. You can't just, meet with somebody one time and that's it. So there's a responsibility there. But what is it that you're being promised? And then look at the fee involved, because it's the same as in person. It ranges from free, because you can get free services in person from some specialty clinics, specialty organizations. You can also get sliding scale for different groups, different in person. You can find the same thing online. You can find many insurance companies now that do cover with insurance. Many employers are offering behavioral health services with telebehavioral health, and they're covering the services. In some cases, there's a copay, and in other cases, there's not, just like in person. And of course, there's private pay where you can get whatever you want. I would encourage you to go for the more conservative route right now, where people are trying to figure things out and see how you do that before you go into any of the choppy waters with very, very innovative, cutting edge. I've been at the cutting edge, I've been at the bleeding edge for over 2 decades now, and I'll tell you, bleeding is not necessarily a good idea. So, what do you do if you run half? I'll wrap up with some of the things you're going to have to do to protect yourself. First off, only work with a licensed professional, because you've got all the laws to protect you. Learn your clinician's full name, their license number, and their credentials, and go look them up, like I said before. And then keep all this information safe. Don't put it on a sticky note and then lose the sticky note. And if you have a problem with the therapist, talk to the therapist. This is part of therapy, or this is part of whatever behavioral health care you're getting, is really talking about the relationship and say, hey, this is really working out. The next thing is keep your cool and don't post negative reviews that are untrue. We're seeing an increased number of professionals that are actually suing individuals for overstating their case, making false comments in review websites. So, some of those sites are a double-edged sword. Be careful about that. Many people use those sites to vent their grievances, and the people that are happy don't necessarily go there, so they're oftentimes skewed. Be careful about paying attention to that, and also posting stuff there, because that's your name and your ID information can actually be accessed by someone who's trying to prosecute you. Clinician is upset you said about them because it's false. Also, if you have a complaint about a clinician and you're offering a licensed clinician, go to their licensing board and then walk away from the clinician. You don't need to be hammering away at a clinician that doesn't work for you. Is your time valuable enough for you that you can walk away and just go on to somebody else that can help you if you really do need to speak with somebody? I'm open to questions. As you send in your questions, let me also caution you that my institute, the Telebehavioral Health Institute, SAMHSA, or any other groups that are associated with this particular webinar cannot endorse any specific service for obvious liability reasons. We can't say, yes, this company is great, that company is not. I'm giving you a very long list of things to think about as you make your own selections. But if you're going to ask questions about, hey, what do you think of this interface or that, we really can't answer those questions.
Marlene, thank you so much for a wonderful session this afternoon. We've had several questions come in, so why don't we go through these in the order they were received and get through them as best as we can. First question, do you think it's good to have at least one face-to-face session? Is that necessary to continue telesessions?
I love this question because it's been one that licensing boards and professional associations have wrestled with since the beginning of telehealth. The answer is that for most people, no, because most people are not dealing with a life-threatening situation. If you look at the full range of services that are available in behavioral health care, it can go from someone who's having an adjustment type reaction and just getting used to something new to somebody who's forwardly psychotic. So we can't make statements like that in general, okay? But for the most part, telehealth at the beginning of its evolution was thought to be, it was based on technology that was not as secure as it is today. The systems weren't as developed in terms of protocols, but now a trained clinician should be able to help render get a reasonable diagnosis along with a reasonable treatment plan. If you're getting care without some type of planned care, it's called treatment plan in our world, then people are winging it, and I encourage you to stay away from that. But if someone can come up with a reasonable treatment plan that you agree to as part of your treatment informed consent, then it's in most cases not necessary to have an in-person session. Although, if you prefer an in-person session, if that helps you feel at ease, absolutely, then you can require it. But it's not as if the authorities require it. It really is an individual by individual type.
Good, thank you. The next question that came in, how are these services being paid for? Are insurance companies, or especially Medicaid, Medicare, are they paying for these services?
Yes, the more and more systems are paying for it. We are seeing that the vast majority of states have now required insurance companies to pay for telehealth across the board. That's for cardiology and dermatology and oncology, everything, including behavioral health care. So they have to pay for it. Not all states, but most states. We have seen a lot of third-party carriers come aboard with those laws. Some have not. Some still are reluctant, even if they're in a state like that, but the laws are catching up with them and they are coming on board. And they are paying for it on par with in-person care. So there should not be a different fee that you get charged, or your copay should not be any different. We're also seeing, I think the stats are on 75% of employers are using some form of telebehavioral health care now. So a lot of employers through insurance companies, but also some larger companies are self-employed, so you'll see that they're paying for it. Medicare has paid for telehealth for a very, very long time, but it is in certain geographic areas. Once again, these laws are changing. This is a rapidly evolving area. So reimbursement for telehealth is making, I don't know how many bills are in Congress right now, but at any point in time these days, there are about 10 or 12 bills in Congress to change the payment system. So a lot of activity is getting bipartisan support. Even in today's environment, it's getting bipartisan support. So we're seeing a lot of change. Medicare has paid for a long time, but limited to patients that are in rural areas that have to go to a practitioner's office or a clinic or a hospital. They don't get services at home. And then Medicaid, once again, is a state-by-state thing. So some states do pay Medicaid services, and a lot of that to the home, by the way, and then some states don't. So that's still in flux.
Thank you. Well, speaking of the states, Marlene, you talked a little bit about the state-by-state regulatory environment. What if the state does not have specific guidelines? What would you suggest then? And should that therapist be practicing telebehavioral health?
Well, I love this question because some people are really confused about it. You can practice, a clinician can practice telehealth in any state. There's no law on the books that says you cannot practice telehealth, or you cannot use apps, or you cannot use email. States don't do that, okay? States may be mute about technology, in which case the clinician is free to do whatever they please, all right? Because once you're licensed, you see, the key is getting a licensed professional. Because once you're licensed, you are required to do a bunch of things, like protect your person, your client's privacy. Well, if I decide to do correspondence therapy, right, where I'm writing letters to somebody, then I need to go the extra length to make sure that this thing is going to be confidential. Right? Back in the olden days, people would write in code. You'd have to decode letters to really understand, right? You think back 200 years ago. So my job as a clinician is to choose the right technology, make sure my client wants that technology, and then figure out how to keep my person safe if I want to use technology. So as in a state that does not mention telehealth at all, I still need to make sure my person's private. My person's information is private. But then I'm sort of not given any guidance, which makes it tougher for somebody in that state. Other states are more innovative, and they have now addressed telehealth, and it's a statewide thing. New Jersey just did this, by the way. So New Jersey just passed what they call a telemedicine law. So that means all of the healthcare providers, from opticians to surgeons to psychiatrists and social workers, everybody needs to follow this law, and the boards get to choose what that means in each of the systems. So it's all over the map, literally, and your best bet is to go to your state and find out. But don't be misled by clinicians that, oh, I can't practice telehealth in your state. What that means is they haven't got a training, right? They haven't learned that, yes, indeed, they can do telehealth. They just need to know the rules, the general rules that can be readily taught online. Our institute's online. We travel, we teach people in person as well. There's a lot of information about how to do all of this, even in some state websites. If you go to the California Board of Behavioral Science, which is for master's level folks, counselors, social workers, you will see there's an entire page devoted to what the consumer needs to know about telehealth in California. So there's a lot of information available about how to protect yourself.
Very good. A lot of questions. You are stimulating a lot of questions from the audience, Marlene. I fear we may not get to all of them. We'll do our best, but perhaps I can suggest that if your question does not get asked, that maybe that person can contact you through your email address. Would that be all right?
Yes. As long as I'm asking which company to use.
No, I know. You're not allowed to say that. But let's go to a very technical question. Are there specific CPT or HCPCS codes that are billed for telebehavioral health services?
Absolutely. There are very specific ones, but in general, the regular codes, regular CPT codes are more than adequate. They simply need to have a modifier code, which is 95, and the place for service code is 02. That's more of a kind of a clinician question. I'm happy to answer it. So, yeah, and we have a course just on that, on reimbursement. So there are, it's been simplified, especially just recently. It's been simplified a lot. There are also specific CPT codes for the use of technology to do certain things, like mental health screening in a primary care setting. So there are lots of these. Psychoanalysis has its own CPT code. Family therapy has its own CPT code for behavioral health intervention. There are codes for a family to talk with the clinician without the patient being present. And then there are codes for families to talk to clinicians with the patient present. So all CPT codes. Yeah.
Thank you. Can you comment on U.S. therapists providing services to patients in other countries?
Yes, indeed. So there are many therapists believe, once again, I mentioned that we just did a research study on this and found that far too many clinicians think there are no rules. There are rules, and I'll just give an example. I was speaking to a group in Ohio, say 2 weeks ago, about 6 weeks ago, and I was talking about Japan and talking about the licensing rules in the United States and how that might apply. There was a Japanese psychologist seated in the audience, and she said, in Japan there's a licensing board, and I had to fly to Japan to go take the licensing exam as a psychologist in Japan. So many clinicians think there is nobody that they need to connect with or report to or be registered with in a foreign country, but that's false. What I encourage clinicians to do is to do their due diligence, and this is the responsibility of the clinician, is to go talk to the authorities in their foreign country in their language. And if you can't do that, find their embassy. Every country that's recognized by the United States has an embassy that can be contacted and ask them for their health authorities, their director of their Ministry of Health, or whatever it may be called in a foreign country, and try to contact them and see if there's a board, because increasingly there are a number of boards that we do need to be mindful of. Now, let me add another thing to that, Alan. Some states are quiet about this issue of their licensed professionals going over state lines with a licensed state able. Okay. Other states are not. Other states that licensed clinicians require those clinicians to be literally registered or acknowledged by the foreign entity, be that a foreign state or a foreign country. The truth is that it's easier to get approval from a foreign country than it is the foreign state of the United States, given the fact that we've got 50 different states. We've got, in most states, 3, 4, 5, 6 licensing boards that don't even agree with each other within a state, never mind a cross state. So it's kind of a difficult thing right now. But that's over international lines does need some caution.
Okay. I think we have time just for one more, hopefully brief answer question. Are peer services available by telehealth?
Yes, there are peer services available. Once again, they're peer services. They're not licensed professionals. So I have interacted with a number of them that are very professionally operated, and their peers are, let's say that in a chemical dependency world, an addictions world, then people are peer counselors, and they're very well vetted and trained, and they are available online through internet services.
Great, thank you so much. Marlene, it appears that we've gone through our 60 minutes together. I would encourage additional participants on this webinar. If you haven't had your question answered by Marlene, or if you have additional questions, I would propose that you contact her directly at the email address shown, which is contact@telehealth.org. And on Tuesday of next week, which is August 21st, at 2 to 3 p.m. Eastern Time Zone, we'll have Marlene back with us speaking more about telebehavioral health, but this time from the provider's perspective. What does the clinician or the provider need to know? If you'd like to be added to our listserv and be informed about future webinars, please send an email to healthitwebinars@aptosoc.com and you'll be added to our list. And as a reminder, all sessions are recorded and will be posted to the SAMHSA YouTube page. With that, ladies and gentlemen,